Welcome to the Expert Edge. This is the show where we bring on experts in their fields of health and wellness practice to hear their stories and learn what they see working in the field of diabetes reversal and prevention. So I'm happy to introduce today's expert, Dr. Nana Quansah. Welcome.
Thank you. Thank you, Lucia, for having me. It's a pleasure.
It's so nice to have you here as well. And for those of you that have not met Dr. Nana, she is a pharmacist, a functional medicine practitioner, and a public speaker. She has a Doctor of Pharmacy degree from the prestigious University of Kentucky College of Pharmacy, but that is not actually where she stopped, because she decided to really improve her expertise way beyond the traditional realm of pharmaceuticals. So she went into the field of functional medicine and specializes in diabetes management. She's the visionary behind Ditch Diabetes Academy, and she loves to empower individuals that are struggling with metabolic health conditions to help them reclaim control over their lives and be less dependent on prescription medications using lifestyle interventions that get at those underlying issues. So it's so great to have you here today, Dr. Nana. Please tell us a little bit about how did you get started with your interest?
Oh, wow.
In health,
we got to go all the way back. We definitely have to go all the way back to my retail days, right? So I graduated about, well, I've practiced for more than 10 years now. So when I graduated and I embarked on my pharmacy journey, you just get in there, you're dispensing medications, and you see a lot of people coming in and out of the pharmacy every month, right? And I realized a couple of things. I realized that, some of them were coming in pretty much maybe frustrated. Some were complaining about the side effects of the medications. And most importantly, I think one that caught my eye was when they were like, I'm not getting any results, right? I'm getting results for a little bit, and then I get back to being sick. So that obviously, I was wondering, I had to be like, Nana, what is going on here, right? So for us pharmacists, they don't really, or even actually practitioners, they don't teach us how to get to the problem itself. We are more so taught how to treat it, right? So when all this stuff was going on, I realized that there were certain avenues that as professionals we haven't tapped into, right? So that kept me wondering. I'm like, why are these patients coming every month? I was under the impression like if you get your medication, at least you should feel better a little bit, right? And maybe I'll see you in 3 months or something, right? But this is the situation where people were coming in every single month. We fill in medications, and you realize that they go from 1 to 5 to 10, and some can even be on 20 medications, right? So it got a bit, I became curious. So what changed this thing for me was just because I had worked with a person that was dealing with type 2 diabetes, and he was able to significantly overcome his type 2 diabetes completely. And that was the only way I knew that type 2 diabetes can even be put in remission or even reversal. So this was just like a casual conversation with him every single time about lifestyle changes. I'm like, do this, stress, your sleep, your nutrition, a whole holistic approach, I guess. But it was on a casual basis. It wasn't anything like very strict or, stringent or anything like that. So one day he came and was like, Nana, I'm not on metformin anymore. And I'm like, who told you to get off the medicine? And then he said, well, I took myself off of, which I don't recommend. Don't ever take yourself off any medication. But I was like, what? This is crazy. So that's when I knew that this illness can actually be reversed or put in remission as well. So that's how it started. Yeah. So obviously I went into a discovery phase, like learning, and I was more interested in the nutrition driven wellness, right? Like illnesses that actually are caused by our nutrition. So that made me land on functional medicine, and I'm sure we'll talk about that later. Yeah. So
yes,
that's pretty much how I got started. So I always thank him for that. I'm like, I'm glad you took my advice. I'm glad that you were disciplined and consistent. And because he got results, I knew that I could bring hope to other people as well. So that was really great. Yeah.
I love that. It's such an interesting story. And I think it's kind of unusual because, like you say, as a pharmacist, you only really see people when they're refilling meds.
Mm-hmm.
And the fact that you just like took a little initiative to share some lifestyle things that you
Mm-hmm.
thought might help. And then
Yeah.
he actually ended up reversing his diabetes by just
Yes,
listening to those little tips.
exactly. Yep.
And, and that he shared that with you so that you could actually like see proof of the pudding, as it were,
Mm-hmm.
and then
He
get curious
came,
about,
yeah.
oh,
Yeah, he came a couple of months, like months into his like, guess what? I am no longer on medicine. I'm like, okay, you got to fill me in. What is going on? And that's when he's like, well, I'm no longer. And I'm like, who took you off that medicine?
yeah, that's so interesting
Yeah.
because, but number one, I think pharmacists are often in that position to actually see results,
Mm-hmm.
for people's changes in that
Mm-hmm.
way. And then I'm so glad that you like followed up on your curiosity around that to actually learn that, hey, this
Mm-hmm.
is a thing. We
Mm-hmm.
can
Yeah.
change lifestyle and really make a
Yeah,
difference to
absolutely.
people.
And I will say this, pharmacists can do so many stuff. It's just not filling medications at all. But because the system is set up for us to, just fill it, especially at the retail setting, you are given metrics and stuff to, make sure you meet those metrics. So sometimes you don't have the time to do the extra things that you have to do to help the patient. So all of that makes it a bit harder. And it's just like the doctor's clinics as well. When you go, it's like 5 minutes, 10 minutes. You don't really get the time to talk to the doctors and tell them your challenges, your concerns and things like that. So it's just definitely, I'm sure we'll get into it. Something that we have to talk about with the
Yeah.
system is not set up correctly.
Right. And especially because you started out your journey kind of on the pharmaceutical end. What are your observations about using medications and their relationship to addressing or not addressing root causes? Like how
Mhm.
does that whole pharmaceutical basket work? What's its focus? Share that
Mhm.
with us.
So I will start by saying that, when everybody thinks about illness, right, we always automatically think, okay, let me take a pill for this illness, right? There's never ones that we ever think, okay, maybe it's due to some kind of imbalance in our body, right? We think of headache, okay, let me just take the Tylenol, right? So as of now, we always think about medication and then, illness, and we associate it with a medication, right? But medications, obviously, they are great. They've done so much for a lot of people. They definitely have their role in healthcare, right? Especially cancer and acute infections and things of that nature. When you have a cold, you want to take something for it to go. So medications usually meant for the acute infections that you're taking. You have, right? But when it comes to chronic illnesses like type 2 diabetes, like, high blood pressure, they are still good, but these are chronic illnesses, right? And medications, they are only meant to treat the symptoms. So I always used to, I tell people to think of an iceberg, right? The top of the iceberg is just what is visible to people. So that's the headache, that's the low energy, that's the insomnia, right? Those are the symptoms that we experience. So
Yeah.
medications, they target the things you see. They target the high blood sugar, the high blood pressure, the insomnia, the low energy, the headache, the skin issues. Those are what medications are targeted, and we didn't even know all this stuff, right? But underneath the iceberg, which is really what carries the weight of what's going on, the medications don't target that. So when you're taking medications, it's more so the symptoms. So that's pretty much why sometimes you take it and your A1C, I know your community is diabetes community, so your A1C is lower, your blood sugar is lower. So they reduce the numbers, your blood pressure is lower. They are reducing the numbers. And of course, as physicians, we love numbers, right? When we see the numbers go down, we're like, okay, that's progress. So that's pretty much what medications do. They don't target what is actually causing the problem. They don't go to the underlying issue. So they really target the top. And when you think about it, even the FDA drugs and stuff, they are approved to be taken with exercise and nutrition. Majority of the medication. So if you're there and you're thinking, well, let me just take this medication, it's just going to reduce probably your numbers, but it's not really going to help you with what's actually driving the illness that you're having.
I think that's such an important concept for people to grasp, that there's a difference between the symptoms you experience and the actual cause of the symptoms. For example, if you have the symptom of a headache, which is a really common one, it could be caused by so many different things. It could be caused by not drinking enough water. It could be caused by too much caffeine on board. It could be caused by malaria. It could be caused by pneumonia. It could be caused by 150 different things can give you a headache.
Yeah.
So when you take the Tylenol doesn't address the underlying cause, like the actual reason you have the headache. And I think that we are in a culture where often people only worry about the symptoms. And it's like, as long as I feel okay, I'm okay.
Okay, exactly.
And not addressing those root causes.
It's more,
Tell us a little more about that.
It's more so the surface level approach, right? Which is a red flag, right? Because the example you gave is just, great. Like you're just targeting the headache, but what is actually causing the headache, right? So when you talk about root cause, it's going beyond the symptoms, right? What is actually driving the illness that you're dealing with? And remember because it's type 2 diabetes community, right? So when you think of type 2 diabetes, you weren't born with type 2 diabetes. Something must have happened along your journey that made you have that. Because remember, when you're diagnosed, you really are comfortably at home. You go to the doctor for an annual checkup, and they're like, okay, let's draw the blood, and then we'll give you a call later, right? You get that call, and they tell you to come to the clinic, and they tell you, okay, you have diabetes. And that's when a lot of frustration comes in, because you're like, diabetes? How did I get that? Right, that's really the diabetes story for many people. So that when that happens, you're really alarmed, right? So when people talk about root cause, it's going beyond the symptoms of what is going on. We are actually trying to figure out what is driving that illness, what is driving you to have that. Something must have happened to your cells, because I'll take you back a little bit to the basics, right? So remember, when we're in school, they thought as the cells make up the tissues, our tissues make up the organs, our organs make up the organ system, and the organ system make up the human being, right? So the health of the human being, or the quality of our health, it depends on the quality of your cells.
Yeah.
So if you're not healthy, we got to go back to your cells. What is going on there? We are not just going to look at the symptoms. We have to go back to the cells. The cells are dysfunction. I'll give you even a better example. A lot of people are trying to lose weight, right? And some people are doing really good. They are eating right. They are not even, like, they are really doing their best. But for some reason, they cannot lose weight. It's the same principle. Weight loss is not a function of you being lazy or anything like that. Majority of the times, it's a function of an unhealthy cell. Something is going on with your cells. And if you don't address that, you will always be frustrated. You will always be on medication, seeking for the next magic pill, right? So it's very important for you to go back to the basics, because you weren't born like that. Something must have happened for you to develop the symptoms and the issues that you're dealing with. So it's very important to always address it. And that's where functional medicine comes in. It's more so a holistic approach to health. And it deals with identifying the underlying problem and figuring out what is actually aggravating the symptom, the triggers that are aggravating the symptoms. And when you can do that, you'll be able, you see that your life will be easier. You know exactly what's causing that, and you will target your action plans towards that.
That makes sense. So what I'm hearing you say is that one of the primary focuses of like a functional medicine or sometimes some integrative medicine practitioners is instead of just worrying about what is the symptom you see or feel, they're going to do diagnostics, they're going to do testing to determine what's actually causing the thing that you're experiencing.
Yeah.
Does that make sense? Okay.
And that is what is different from, the conventional therapy, because that is more so, okay, what symptoms are you having? And based on the symptoms that you having, we'll give you a pill for that, right?
Yeah.
That's what, but we have to go deeper because you were not born with this. Something must have happened. So what is that something, right? Because when you think about how even insulin resistance happens, I know you probably talked about in your show so many times. And whenever we eat, it goes to sugar, right? So now you have a lot of high blood sugar in the blood. And then the hormone insulin has to be secreted to carry that blood sugar to your cells for energy, for your brain to use, for your muscles and all that, to your muscles to for you to move and all that stuff. But when you get to the cells and the cells are not opening up for that to happen, something is wrong. So you got to look at what is going on with the cells. That's where insulin resistance comes into play. The cells are resistant to insulin. So what is causing that resistance? That's what we got to figure out. And it could be so many things. It's unique. It's not one size fit all, right? It can be gazillion things. So it's not like a one thing that causes it. It can be so many things based on the individual.
As we think about then the importance of addressing the causes, so say the cause has been determined, and so we want to now reverse our pre-diabetes, metabolic syndrome, or type 2 diabetes. Can we just, just kind of do random things, go on the internet, Google something to do, or do we really need some kind of structure or strategy to be successful? What would be your take on that?
Yeah, so I would say, like I mentioned before, it's not like a one size fit all, right? Because just because someone eats whatever, just whatever rice or whatever, and it works for them, doesn't mean that it will work for you. Everybody is unique. So you have to have a unique approach to what is going on with your body. Our body sizes are different. We are all not the same size, right? So even if we eat the same, we all not going to get the same result. So individualize or tailoring your plan to what is actually causing your problem is very important. And when it comes to sustainability, that's the key. Because you see that a lot of people are doing a lot of things, but it's not sustainable. If you keep chasing after the next fastest thing that will reduce your sugar, you will continue chasing after that. So sustainability is really key, right? It's very, very important. And when I think of sustainability, for it to really work, you have to have a structure in place. I believe that structure gives freedom. And it's not only when it comes to even illnesses or diseases, it's just structure gives freedom for everybody. If you have a goal or if you've written down something, you have to have some kind of structure to be able to execute the plan that you have. So when it comes to structure, it's very important. It gives freedom because you have two set of people all trying to reverse their type 2 diabetes. They all determined, they are all doing all the things that they are supposed to do, right? But one person can have a structure in place. And when I say structure, I'll go deeper into it a bit. But let's say they get up, they have a purposeful goal, daily purposeful goal. Every day they have a goal. They have to have an attitude of gratitude. You cannot get up and just be mad. I know it's very frustrating. This illness is nothing to be played with. It's very difficult sometimes. It puts a toll on your body mentally, emotionally. So it's very hard. But we all have to have an attitude of gratitude, because if you're in that gratitude phase, it actually makes things easier. It makes you think clearer. It makes you make the right choices. So one, you want to make sure you have a daily purposeful goal, attitude of gratitude, right? And you start tracking, because what you don't track, you're going to fail. You only fail if you don't plan, right? So you have to make sure you're tracking, and not just tracking your blood sugar, but different things. You're tracking your stress level, your water intake, your sleep, because all these things are contributing factors. These are all important. It's not just the food that you're eating. How long did you walk today? All these things are very important. So when you start tracking, it will help you as well. And it also, I think a structure will also help you increase your own self-awareness beyond blood sugar readings, right? You'll be aware of certain things that are going on in your body as well. And I always say that, most people, you see them using just a notepad, right? And writing, okay, my blood sugar is that. But I always advise my client to use like a diabetes journal. It's more structured. It has prompt. It has sections that actually, even when you forget, it's prompting you. It's telling you to, okay, check your stress, check your blood sugar, obviously. What did you eat? How much did you eat? And so let's say in the morning, if you get up and your sugar levels are high, the first thing you want to think about, what did I do the night before? Right? How much sleep did I get? But if you don't have a journal that you are writing all these things down, you won't be able to adjust and make it better, because you just be doing things on the flow, right? You would just be doing things with no structure. So I think all these things are really important when it comes to building a sustainable lifestyle. You have to have a plan in place.
I love that. So, some of the plan pieces that I heard you mention was like having a morning routine,
Mhm.
making sure our mindset is right with that attitude of gratitude.
Very
And
important.
yes, and then really tracking what it is we're trying to implement, be consistent with, or make
Mhm.
changes around. So tracking helps us to actually focus on the things that are going to move the needle
Mhm.
and get
Mhm.
us closer to our goal. Is that what I hear you
Yeah,
saying?
exactly. Because, think about it, Lucia. So when you set a goal, right, we have our goal, we start tracking it because you want to know whether you are actually doing. It's one thing to just say, I'm going to exercise, right? But if
Yes.
you start tracking from Monday, Tuesday, Wednesday, Thursday, how much exercise did I do? What did I eat on Monday? What did I eat on Tuesday? It's a bit daunting, but it helps.
Mm,
Because if something is going on, you can always flip up the page and look at what you ate the night before,
mm,
how much you ate, and be able to adjust accordingly. So once you see
mm.
that, it builds up momentum as well, because you start seeing positive results. And what happens when you see positive results? It creates a momentum for you.
Yes,
Right? You're like,
absolutely.
okay, let me keep going because this is working. But if you're
Uh-huh.
not tracking even your positive result, your wins, you're not motivated. I mean, motivation, I always say that motivation comes and goes. So don't even rely on motivation. Don't.
Right.
You got to build a discipline as well. But once you see a positive result, you'll be able to make adjustment, and that create momentum for you, and you will never give up. Yeah.
I love that. And so that is kind of the foundation of a sustainable structure that
Mm-hmm.
allows you to reverse your diabetes. So it
Mm-hmm.
takes some planning. And I can tell by listening to you that you are probably a kind of a planner.
I
Some
do
people.
have like 1,000 journals. I'm
Yes.
always going to Ross to get a journal. Like I'm always there trying to get a journal.
I love it. And so maybe that's not your strength as a listener. Maybe you hate to journal. But
Mm-hmm.
even if you hate to journal, there are simple ways that you can still track.
Mm-hmm.
So journaling is one way, but like I have a client just yesterday I was talking to, and she's just using tally marks on the refrigerator to keep track of
Mm-hmm.
how much water she's drinking. It's like it
Yeah.
doesn't have to be complicated. Y'all can do
Mm-hmm.
this.
Yes,
Um,
it
but I
is.
do want to encourage you to actually think about how can you create structures in your life that help
Mm-hmm.
support the things that you know you need to do. Because I
Mm-hmm.
find that a lot of the time you actually know what you need to do. The gap is having either the accountability, the support, or the tools
Yes.
to move forward.
Mhm.
And in terms of tools, resources can be really important. And I'm so happy. Dr. Nana brought us a free gift today. The link for this gift is going to be in the description right under this video. But I'd love for you to tell us a little bit about what this gift is and how will people benefit if they choose to click on the link and get this free resource.
Yes, so I wanted to share this with your community because, I want to emphasize first that it's very important. The first thing you have to do is to actually get to the root cause. But for us now, we just want an immediate action. We got to take action right up until when we can get to the root of what is driving our illness. So this free guide is 6 things that you can do right now to actually prevent you from having high blood sugar levels or, without restricting your meals. So it gives you practical, easy to implement strategies. These are not anything that are hard. These are really easy because you got to start with the easy stuff first. If you start with something tough, you can't go on. So this is just 6 things that you can do right now. And it's more practical and it gives you the strategies, not just, do this, but it gives you the steps on how to actually do it as well.
Oh, I love that. That sounds like something very useful. So I would encourage each of you to click on that link under this video and access that resource that Dr. Nana is sharing with us today. And I want to say I really appreciate you being here and helping us think about how do we approach diabetes reversal in our lives in a way that's actually going to address the root causes so that we eliminate the cause instead of just treating symptoms. And I think that's so important for us to all understand that symptoms are important, but they aren't the same as addressing the cause. So we want to always be looking at what's underneath. And so I just want to say thank you for being with us here today. I've really enjoyed this and I think we have some very valuable takeaways. And for all of you listening, just remember that health is wealth and it comes by choice, not by chance. Thank you for being here with us today.